Less than 2 weeks ago, we saw Republicans vote to completely gut Medicaid, which covers nearly half of all births in the United States. And they did this despite the fact that the United States, the richest country in the world, also has the highest rate of maternal deaths among all wealthy countries. Black women in particular in America are dying at more than 3 times the rate of white women in childbirth. And we also have the highest rate of infant deaths overall compared to other high-income countries. We're also the only country that doesn't guarantee healthcare as a basic human right. Dr. Chen, as a medical provider, can you speak to why the United States has such high rates of infant and maternal mortality?
This is not actually my area of expertise, so I don't want to speak out of turn. Our Maternal Child Health Bureau does cover this issue very, very closely, and we're happy to follow up with you afterwards.
I understand. And given this, I also think it's important that we talk about the Healthy Start program. The Healthy Start is a federally funded bipartisan program whose sole purpose is to reduce infant deaths and improve the health of pregnant women and new mothers. There are more than 115 Healthy Start programs across the country in both Republican and Democratic districts. In fact, Healthy Start was actually created by Republican President George H.W. Bush in 1991. Healthy Start programs, like the ones in my community in the Bronx, provide education for new parents so that they can safely care for their baby and one-on-one support through home visits. They ensure that families are connected to the services they need, like housing, food, transportation, and prenatal and postpartum care. Dr. Chen, your agency oversees the Healthy Start program, correct?
Yes, in the Maternal Child Health Bureau.
And as I mentioned earlier, it was created under Republican President George H.W. Bush, but since then, Healthy Start has been reauthorized several times on a bipartisan basis. The last time it was reauthorized was during President Trump's first administration. And that is because Healthy Start works. Women in Healthy Start receive earlier and more frequent prenatal care, fathers are more engaged, and babies are born healthier under this program. I'm proud to be leading the reauthorization of this with Representative Malliotakis and continuing the bipartisan tradition of this program. And I'd like to urge my colleagues to support this common sense bipartisan effort to reauthorize Healthy Start. I also want to briefly turn to another bill we are discussing today about sunscreen, which was led by my colleagues, Representatives Joyce and Dingell, which was spoken to earlier today. With respect to sunscreen, as skin cancer is the most common cancer in the United States. And for people who work long hours outside, like farm workers and construction workers, adequate sun protection is essential. Yet the Food and Drug Administration, or the FDA, has not approved any new sunscreen filters since 1999. Yet our counterparts in Europe and Korea and many other markets around the world have been able to bring much more technologically advanced filters to the market. And the reason this is important is that it's not just a cosmetic issue. The easier sunscreens are to apply, and the more elegant these formulations are, then the easier and more commonly adopted they will be for people to use. If they are uncomfortable, if they smell bad, if they have all of these other issues, folks who work on farms, folks that work in construction, people who work in the sun are less likely to use them, and it elevates cancer risks for working people. And so I am deeply supportive of efforts within the FDA to help streamline a safe process for approving these new filters, ensuring, yes, we want to make sure that there aren't endocrine disruptions or any other kinds of issues, ensuring the safety of these, but surely we can come to a process where we don't have to wait 25 years between filters when we're being outperformed by the rest of the world. So I want to express my support for those efforts and ensure that we can get this moving. because it's just simply unacceptable. And Dr. Corrigan-Curray, why is the United States so far behind other countries when it comes to available sunscreens?
So in some countries, these are regulated as not as drugs, but they're regulated as cosmetics. And we regulate them as drugs, and we've done some testing. We know they're systemically absorbed, and we need to, look at that data. If we had that data in hand, we would be ready to review as many as sunscreens as was submitted.
Thank you very much. And I yield back to the chair. Thank you.